All right. So we're talking about childhood oral rape, and we're going to talk about medications. And as far as the medication with the PTSD and the comorbid simultagnosia, the evidence proves that medicine may actually cause a relapse in the behavior. So, what was found in the research is that they would give, clonazepam or, some sort of antidepressant to the patient. And um, without the medicine, the person would relapse. But then they couldn't live without the medication, and then they would relapse. And then they would give them the medication and they would relapse. So, what they found is that medication doesn't necessarily work. Um, it's actually, it seems like, keeping them on the medication would stop the relapse, but it doesn't. And they have to remain on it forever if they're going to take it. So it can actually endanger other parts of their body, their livers, their kidneys, all of these things. And so really looking at medication, it's hard to say that it's something that needs to be prescribed. And I think in terms of medication, it would be something that should be handed off to a medical doctor to evaluate. I don't think it's something that psychology really looks into as or has enough knowledge to even say whether it's right or wrong. But as far as medications and addictions, I think psychology does have a say in whether or not something is addictive. And if the medication is causing these relapses, then it's probably an addictive form, and it could actually increase substance abuse disorder, which would make a person very sad. SAD, that disorder as well. So pharmaceuticals could work. However, there are other biological bases that work as well, that are just, simple dopamine reuptake inhibitors, that like melatonin, those, just a simple supplemental um, melatonin pill can actually works better than clonazepam, which is a drug. So we're sort of looking at like, um, reuptake inhibitors and things like that that don't have so much drug in them, to help eliminate and actually inhibit dopamine reception to the G protein, because that's when the brain comes together like this and the person is able to focus, their memory is good, and they're able to process what they need to be doing. And so that's what we want to have happen. And so medicine is a vital resource in some cases. In PTSD with the comorbid simultagnosia diagnosis, however, I think limiting it so that we don't have substance abuse problems is really what we're looking for. And codependency, on a drug. I think that's another dangerous thing when we're talking about meds. So, again, just, over the counter remedies are recommended. And, um, you know, that way a patient is able to live a whole life, and, not a drug induced one because of what happened to them, either is happening to them or what did happen to them. We want them to be able to live, without drugs because of it. We want them to live a whole happy life. So that's the medications aspect of it.